Good morning and welcome to this live broadcast. My name is Walter Mwesiji, and today we're going to be speaking about COVID-19 infection prevention and control. You could call it IPC. But then to share this with me, we have Dr. Mulungi Mariam Nantambi, the Supervisor Medical Services, Lubaga Division, and Dr. Louis Nyende, also Supervisor Medical Services for the March India Division. And these two are here to talk to us about many things that have been done by the Kampala Capital City Authority in terms of the COVID-19 infection prevention and control. The numbers are still in, four figures. For example, we had 1,277 cases of COVID-19 registered on the 22nd, and the deaths are also still in double digits, 29 on that day. But what is more interesting with these figures that we receive every day is the test positivity rate. And I want us to kickstart our conversation from there. Someone who gets these updates daily looks at these figures, and there was an announcement that they are going down a bit, but the test positivity rate oscillates between 14, 15 and 20 sometimes. What does this mean, Dr. Mulungi?
Well, Walter, maybe for the viewers to have a glimpse of. Yes, I'm Dr. Mulungi. Well, when we're talking about positivity rates, we are looking at how many people are testing positive out of 100. And before, our positivity rate used to even be 5%. Like 5 out of 100 people would test positive. But right now, out of the samples that go to the lab and are tested for COVID, you find that the rate goes up to as high as 20 people out of 100 people testing positive for COVID. Of course, this has a huge impact. It means that basically so many people within the population have what? Have COVID. That COVID has penetrated the population so much so that out of 100 people, at least 20 people have what? Have COVID. That's huge. That's huge. It means most likely the other 80% are just sitting on a time bomb and are also soon be going to test for positive for COVID.
That's a very good thing, because I think many people out there didn't know what this actually means. And now they know that this determines where we go in the future. But back to our topic today, and of course a lot has been done by health workers from selected health facilities around the 5 divisions of Kampala. And when the new lockdown measures were announced by the president that put a limit on in-person engagements, KCCA has been providing, pivoting the planned interventions, including the use of media. So we would like to understand, first of all, when you talk about infection control and prevention, what aspects are you looking at?
Okay. Thank you very much. My name is Dr. Louis Nyende, Supervisor Medical Services, Makinde Division. I'll put my mask back on because that is the new way. So infection prevention and control, all those are English words, and you realize that in the setting of COVID-19, we're trying to mitigate people getting disease, getting COVID-19, and that's through practical and evidence-based approaches. Things like hand hygiene, things like cleaning your surfaces, disinfection, sterilization, vaccination. So those are some of the practices that are aimed at mitigating people getting the disease. And which people? In the health facilities, we have the healthcare workers, we have the patients, and also sometimes we have the visitors that come in. So we want to mitigate cross-infection from the patients to the health workers, but also want to mitigate infection from the health workers to the patients and the visitors. So all that is geared at maintaining, making sure that when they come into the facility, they don't walk away with another infection.
Yes.
Yeah.
I am speaking to you because Kampala is one of the hotspots in this country.
Yeah, sure.
And the impact of the upsurge of COVID-19,
Yes.
is evident. And of course, on KCCA affiliated health facilities as well, in terms of service provision. But what would you say is the current COVID-19 wave effect on service provision at the health facilities so far? I don't know. Any of you can, take it away.
Well, maybe just to take you back to where I come from, that is Lubaga division. We have seen, if you look at our data from January to date, we have seen an increase of about twofold of outpatients. In January, like in Kawala, we had 2,500 clients. But by May, we had about 4,000 clients. That is quite huge. That is quite huge, and the numbers are keeping on swelling. Of course, again, it might come down a little due to the lockdown, because you realize that most of our clients also come from the neighboring districts.
Yes.
You find them coming from Wakiso, Nansana, Nalumunye. So you might see that the numbers are coming down a little bit, but actually the month of April was the highest. The numbers actually shoot up by twofold, and that is quite a stress on our facilities, on our health workers, on the logistics and other things that we use at the facilities. Yeah.
Okay. Dr. Louis.
Yeah.
Is the situation the same? What
yeah,
is it
the
like
situation is pretty the same. Of course, with the increased surge, it means the communities out there are also calling in. Because many people call us, someone has collapsed, has what, and we have to reach out to them. And yet sometimes we are constrained with resources. But also the other thing is, with the increased surge, even health workers are not spared. And realize if they test positive within the facility, you have to give them an off for about 2 weeks. And remember, we have inadequate human resource. So if they are away, it means even they will not be able, the few staff that remain will not be able to take over the number that is overwhelming the health facilities. And of course, once you have increased numbers coming to your facilities, then the risk of trying to mitigate infection prevention and control becomes a problem. Social distancing is almost impossible because of the numbers. And also the other resources are constrained, resources for testing and also medications for those who may need medications. Yeah. Okay, so if you've just joined us, we are speaking about the COVID-19 infection prevention and control, you'd call it program or plan from the Kampala Capital City Authority. And I have Dr. Mulungi Mariam Nantambi, who is the supervisor medical services in Lubega Division, and Dr. Louis Nyende, supervisor medical services in Makindye Division. Yeah, so far the discussion has been about the impact of COVID-19 on the facilities. And we have learned that it's twofold, both ends, patients and health workers. But how have you mitigated? Because this is the second lockdown. Yes.
Numbers, shooting quite up. Even with the preparations that had been put in place from the first lockdown, what have been the changes, and how are you trying to, put the efforts together to try and continue serving, but also being wary of the problem that we have at hand?
Yeah, thank you very much. COVID-19 has a number of pillars that you're able to combat the disease. You don't look at only one aspect. Yeah. The initial lockdown, we saw an increase in people, for example, people who are HIV positive were not getting their medications adequately. So they came up with the 9 pillars to try and mitigate some of these things. And some of those pillars include things like risk communication, case management, and infection prevention and control is one of the pillars. So what KCCA has done in the facilities to try and mitigate some of these things is right at the gate, as people walk in, we screen everyone that is entering. How? Before you're screened, you wash your hands with soap and water, and then your temperature is taken. And if in event that you have a high temperature or you have symptoms of COVID-19, then you're isolated or put somewhere so that you don't mix with the other people. Then as you enter the gate, after you hit the screening and the temperature assessment, the hand washing, while you wait to see the doctor, there is what they call triage. Triage is you try and find out who has the danger signs, who will most likely die first if I delay to attend to them. So there is a triage system. If someone has symptoms of COVID-19, they are quickly picked out and isolated and handled very fast so that they don't stay so much in the facilities. And then the healthcare workers, we ensure that they are protected. How? We encourage masking. There's a new guideline that if you're in a health facility, you should wear double masks within a health facility. So we ensure that they put on double masks, but in addition, other protection. There is what is called personal protective equipment. And in that, you have things like masks, you have gowns, you have gloves. So our workers, we encourage them not to work in these casual clothes they come with from home. They have a uniform. When they get in, they put on their uniforms, wear their masks, and also if they are to do any procedures, they wash their hands, and also gloves. The gloves are provided for them to be able to handle the patients, and also limiting the waiting time for the patients. Because the more time they spend in the facility, it means that the exposure time is increasing. So we try to mitigate that. To try and attend them fast in, fast out, or if there are emergencies, we handle the emergencies fast and we mitigate the problem.
Okay. Yeah. All right. So, Dr. Nantambi, I have been at some facilities, both private and government, and I was there to basically see what is happening, how they are conducting business, and I noticed that some health workers actually don't put on masks. Even some of them who are taking the COVID-19 tests. And, some still take it quite loosely. And they think probably I was vaccinated, they say I was vaccinated, so I am safe. But is there any communication link between the patient and your office, for example, if I noticed something like that?
Oh, sure, yeah. We have our toll-free line at KCCA, and indeed people have actually called in. One time as a doctor from another facility called in and said, Dr. Mulungi, health workers here at Chitebi doing this and this, I think there will be a vehicle for transmission of COVID. And we put that, health workers are human beings. They also have thoughts like other human beings, though they might have informed thoughts, but some of them might actually want to behave like everyone else. But yes, so we do something. We have an upper hand, and we try to make sure that they work within the set standards. Of course, that comes sometimes with a little bit of carrot and stick, but yes. There is a means of communication. We have our toll-free number 0800-990-000, where a client can actually report and say, this is what is happening here, and then we try to make sure that stops.
Okay, that contact will be important for the future. You want to come in?
Yeah, in addition, our numbers are publicized at the facilities.
Yes.
They are written all over the place. In case you are charged, you call this number. In case you're not accessing a service or someone has treated you unfairly, our numbers are publicized. They can call us, the supervisors, or they can call the manager of medical services or the director of public health, so that some action is taken. And also there are suggestion boxes that are available and opened on a regular basis. And we actually check out and find out. And then also the patients have rights. We encourage the patients, when they are waiting to see the doctor, we have health education. We tell them and inform them about their rights. If you see I'm not maintaining your rights, it's your right to tell me, please wear a mask, or please change the glove, it's visibly dirty.
Yes.
Yeah.
Okay. Why do you opt for infection prevention and control? And as you tell us why you opt for that, Dr. Miriam here will tell us what you have put under infection control and prevention in the 5 divisions that is going to be executed.
Okay. Yeah. Okay. So why we opt for infection prevention and control? You realize that you want to contain the infection in a limited space so that it does not run out of control. So there are obvious benefits of infection control. First of all, you, the caregiver, is protected, and not only you but also the attendants of the patients are protected from getting cross-infection. Then some of the patients that come to the facilities already have another illness. So you don't want them to come with another illness and then acquire another illness. That means if they don't acquire another illness, it will shorten their stay in hospital. It will also not put a burden on them paying for extra costs for managing something they did not come with. And another aspect is financial gain. The resources become constrained if the infection runs out of control. They always say prevention is better than cure.
Yes.
So if you look at what is happening now, bills running around, and that is management. But if you look at the prevention aspect, the money you spend in prevention is much less than the treatment aspect. Yes.
Okay. So how are you going to implement, or what have you selected as the measures to be implemented under this infection and control plan?
Thank you so much. The infection prevention and control, of course, starts from the community. We have planned and we are executing a lot in the facilities, but this has to come right from the what? From the community. At the facility, I'll talk about the standard measures. Those are the ones that we've been doing. I mean, from time memorial. A health worker will know that before I work on any surface, it has to be cleaned. Before in the lab, there should be no cross contamination of what? Of samples. That there is proper waste management with segregation. That there is that you wear the right PPE. And as KCCA, we've provided all that. We've worked with a number of partners. We've even gone ahead to make sure we have a result-based financing mechanism in our facilities. And right now we are prioritizing that money for just infection prevention and control. We have put in place, these have been around, the IPC committees in every facility. These monitor and evaluate IPC in each health facility. So we have all those measures, but we also have the additional measures, the SOPs that we are now following. In the past, you wouldn't go to a health facility and find Dr. Mulunji putting on a mask from morning up to evening. But yes, as Dr. Luis was saying, right now we are even double masking. You get, we are making sure that people are segregated right from the gate and make sure they are isolated. That wasn't before. So those are additional measures. But again, from the facility, from the community, we are telling the community, do not come to the facility unless you need to do so. Do not come to the facility just to check on Dr. Mulunji. Do not come to the facility just come to the facility if you really need to come to the facility. And that is why we also have our toll-free line, so that you can call in and ask, I have these symptoms, do I have to come to the facility? Something like that. So that we reduce on this commotion in the facility, we reduce on the numbers. Our health workers are falling sick. They may not be getting the COVID from the facilities, but from the community. And we are seeing so many of our health workers falling sick. Some are admitted in ICUs, some are dying. So we don't want this to continue. We have to reduce the burden on them by making sure these people don't come to the facilities. We are putting up different health medical outreaches so that people do not come to the facility if you don't need to come. If you just want a drug refill, HIV testing, if you just need antenatal care, you can get it from the community rather than the facility. We are also making sure that the wash facilities in the communities are functional. you'll find that most of our markets right now have a hand washing facilities spread across, so that to make sure that there is mitigation in the communities. We are telling people, do not gather. Do not gather, do not come to town unless you want to come to town. And we are going to enforce that quite a lot. Yes.
Okay. Maybe
yes,
an addition is vaccination. We've emphasized vaccination for the health workers, and also testing. For those who have signs and symptoms, the testing is within our facilities. They're able to test at no cost at all. Yeah. And also those that fall sick are able to get the basic medications as a start-off point. Yeah.
Okay. So a lot has been said and done about COVID-19. It's been here with us since 2019, and you know, the measures have been communicated, prevention and all, but still have the cases, you know, surging.
Yeah.
And when you look at the community and the disease, this is a, you know, behavior change illness or infection. So what do you find a challenge in your division, for example, in Machindye, as regards to infection control and prevention within the community?
Okay, so thank you very much. Within the community, of course, as you realize, we want also the community not to get infected, and also we don't want the community to come, people in the community to come to the facilities and infect us. So the challenges we've had with infection prevention and control in the communities is we've had presidential directives, stay at home, social distancing and all those aspects. So we still have those challenges. People are not wearing masks, and some of the hand washing facilities, some for the private areas are not functional, and some of the temperature guns are not working. So just as you mentioned, it's behavioral change, and how we've tried to mitigate that is continuous sensitization. We've not lost hope. We've done continuous sensitization, because if you go on the aspect of enforcement, it means you'll come and start arresting people and then crowding them, and then you cause more infection control. So it's continuous talking to them. And also we engage with the political heads and the RCCs and the police, the DPCs, to try and enforce some of these things. Because as you realize, one time I used a taxi before the lockdown, and people there were adamant. They were saying there is no COVID-19 in Uganda, and they were saying this is just a money-making gimmick and all that. And you feel sad about all that. Yet if you go, if you encourage, actually we've encouraged people who have suffered from COVID-19 to tell their stories, so that people can know out in the community that actually COVID-19 is there, and actually people should take it serious.
Okay. Yeah. All right. Thank you very much, Dr. Louis. We are going to take a very short break from here, and when we return, we shall still continue with our conversation on infection control and prevention, but also speak about the aspect of vaccination, because KCCA is also partnering with the Ministry of Health to ensure that they vaccinate people even during the lockdown. How will this be done? The medics are here to tell us. Welcome back. You're still watching NTV, and we are discussing the COVID-19 infection prevention and control plan from the Kampala Capital City Authority. I have with me Dr. Mulungi Mariam Nantambi and Dr. Louis Nyende. All these are supervisor medical services health workers for Lubaga and Machindye division. If you've just joined us, We've been speaking about the plan they have and how they're going to implement it, of course, during this lockdown. And majorly is tightening the noose on how to prevent yourself from getting infected with COVID-19. Wash your hands, sanitize if you can access it. Also, do simple things like putting on a mask and, keeping that social distance even when you are at a health facility or in public spaces or spaces that have, about more than 5 people, crowds generally. So stay away from them if you can. Now, we want to go into the issue of understanding our numbers and, figures around the city. We have, slum areas in the city that are quite congested. And when you talk about things like social distancing, someone would think it's very tricky. But how are they performing in your observation? Dr. Nantan, you can tell us.
Thank you so much. When you look at slum areas, I'll go straight back to, again, Lubaga. Lubaga is like a huge, big slum with just a few dotted formal settlements. But basically, most of it are informal settlements. And you find, I was so worried about the slums. Because when you go to a place like Kavao, you go to a place like Kabowa, Sembuli, you'll find 7 people staying in one single room. Children and their father. And when you talk about stay at home, basically it's not really stay at home. These are people who have to get out of that small room every day and at least go out and breathe, have their children play and interact with the neighbors. It's not like they have fences and gates. It's really difficult. But fortunately, these people actually not calling in as much as the affluent. That they are not getting, probably they are getting infections, but it's not as bad. They are not getting the severe form of infections. I don't know if God is really just intervening there. We've not really done enough research to understand. Sure. But most of them, yes, will come with a mild flu, cough, and things like that. But the severe infections are not really coming out from such communities. So for now, we are a bit, I think it could also be because we've put a lot of emphasis on the slums, because we were really scared. We were really scared about them. We have our Weyonje program, which is basically right there, trying to make sure slums are clean, slums have toilets that are emptied all the time, slums have stand water pipes to make sure they are washing hands. We have put a lot of emphasis on the slums, and it could be the reason. But it could also be that they also have developed immune systems, which are quite different from the other communities.
Okay. All right. So, Dr. Nyende, I want you to, explain to the viewers out there about, the infection generally. We've been having a wave of cough and flu, symptoms almost similar to COVID-19. But we also know that we have many people who are asymptomatic. Yeah. At what point should one, decide to take the test?
Okay, thank you very much. Initially when we began, it was clear, cough, flu, fever, difficulty in breathing, probably have COVID-19. And when there is a season, dry season, majority or a number of people have those symptoms. So there is a case definition that meets the criteria for COVID-19, that could be COVID-19. But again, another problem comes in that there are those patients who don't have symptoms at all.
Yes.
They are symptomatic. The best way to catch the ones that don't have symptoms would be to do mass testing. You just go out and do mass testing and find out that these ones have the disease, these ones don't have the disease. But for those that have the symptoms, they are well known. Cough, flu, fever, difficulty in breathing, loss of smell, loss of taste, general body weakness. And if you look at that, the other symptoms, vomiting, diarrhea, they may also be related to other diseases like malaria. Yes. So that's why when you go to a health facility, they don't only evaluate you for COVID-19, they also evaluate you for malaria. So I would tell the community that if you feel unwell, because we are in a resurgence now, if you feel unwell, because we've seen people presenting with bizarre symptoms, they collapse, or they vomit, they have diarrhea, and it's not related to the upper respiratory tract infection. So I would say if you feel unwell, just go to a health facility and you'll be able to test for COVID-19.
I actually know of someone who had diarrhea
Yes.
as they were recovering for about 3 to 4 days.
Yes.
And he had to take ORS and all that. But, well, that said, I hope you out there really take this infection as seriously as it needs to be taken. Once you feel unwell, like Dr. Nyende said, please don't wait, because when you wait, I'll ask Dr. Mariam to tell us what happens when I wait for long.
Of course, again, when you wait for long, first of all, you might be thinking, this is COVID, there is no treatment, it will go. But it could actually be malaria. And unless some magic happens when you have malaria and you don't get treatment, you will surely die. So if you sit for long with this illness, you could be harboring some other even worse illness than COVID. You get. So it is better you go, test, have all these tests, and we know what exactly is happening. You know, Kampala has always had a malaria prevalence of about 1%. And but we've seen cases of malaria also rising up. We are actually battling with 2 epidemics, malaria and COVID-19. So very many people have actually sat home thinking, this is COVID-19, I'll take my ginger and take hot tea and wait for difficulty in breathing to come to hospital. Yet it's actually malaria. And they've presented with the last stages of severe malaria. So let's just test. Let's have us checked out.
Okay. Now that we are in a lockdown, I want us to look at the referral system. Movements are curtailed, and for some people it's quite difficult. There's no doubt about that. Yeah. We saw the figures and statistics from the first lockdown. They were not very good. People couldn't get their refills for several drugs. How is the system now? Has it been changed? How can I access a testing facility or even medication?
So thank you very much. Right now, you realize from the presidential directives, I think on this lockdown it was very clear. They were mentioning if you're unwell or you're taking a patient to the hospital, they will not disturb you and they will give you the way. And then the other aspect is for people who need the COVID-19 test. We've tried to bring the COVID-19 testing to areas that are near them. Okay, so if you realize the distribution, I'll mention for Makinde Division, we have a testing center in Chisugu which can supply the slum areas, Kasamvu, Kanyuguga, Namuongo, and the likes. And then if you go up this side, Chivuli Muslim Hospital can test, so people around there can go and test. Then Zambia Hospital, so people in Zambia can access the test there. Then if you go to Salama, that side, Munyonyo Chirudu National Referral Hospital is able to test people. Then other facilities within those other areas. So there are facilities actually near them. And then the other aspect is we have the toll-free number. If you are in any doubt, you call that number and you say, I'm here, I'm in Bukasa. Where can I go for testing? You'll be advised and be told where to go and receive the testing. And then of course she mentioned about drug refills. Yes. We have that aspect of community, of delivering drugs, for example ARVs to the communities. For example, if people are fine, they have a system, you go somewhere and you bring the drugs to them and you give them the drugs. For those that need to be taken to the facilities, still if you call the toll-free number and you need an ambulance can be availed to take you to another facility where you need to access care.
Okay.
Yeah.
All right. So is the testing free of charge, or do we have to part with some money?
So the testing is free of charge in the government facilities and also some public, some private facilities, but there are some private facilities that charge. So if you think you don't have the finances, you can go to the public facilities. The testing will be free of charge. If you go to the private facilities, they may charge you for the test.
All right, so we have, about 15 minutes or less, and I want us now to talk about vaccination.
Yeah.
It is key. The viewers out there must understand that infection control and prevention, or prevention and control, is not only by washing hands.
Yeah.
But even when I get to understand my status as positive or negative, it helps to take the next step.
Yes.
Isolate myself, be in one place and don't infect other people.
Yes.
I have controlled it there in my small space. And if I get vaccinated, then I am not going to be able to get severe disease. Research is still going on to see if fully vaccinated people can still be, you'd call them carriers, or can spread the infection. But we want to hear from you, Dr. Mariam. We know for sure that today KCCA is going to receive 57,480 doses for the various facilities. How is this going to be handled, and when is the vaccination actually starting?
Well, the 57,000 or so doses are going to be divided amongst the 5 divisions. Now, each division has 8 vaccination sites. These have been carefully selected to make sure that at least there is a vaccination site near where someone stays. At least 2 parishes, at worst 2 parishes, sharing a vaccination site. So the issue of access should not be really huge. So these places are going to be receiving people. We are going to be reinforced. The HR issues are going to be reinforced with UPDF HR. We're going to have these sites open every morning up to evening to make sure that we receive all the people who have come for vaccination. But again, just maybe to emphasize, the vaccination will be for the second dose people. You realize that 57,000 also doses are just a drop in the ocean. They're even not enough for the the guys who got their first dose and are waiting for the second dose. So we shall be really vaccinating the people who are waiting for the second dose, and also health workers who missed out the first dose. So please, the people who are supposed to get their first doses, wait at home. Don't come to argue with us at the sites. Stay at home, and we shall be letting you know when we get the next consignment.
Okay. All right, Dr. Nyende, for you, I want us to, highlight some of the, issues that have been raised with the public about vaccination. There's so many myths and misconceptions about vaccination, but I don't know if you're a football fan.
Yes, I am.
For example, currently the Euros are going on. Stadiums are filled.
And people are not wearing masks.
Yes, people are not wearing masks. So, some people are wondering, so how is this being done? Of course, one part, the anti-vaxxers want to say, it's a ploy. But what actually happens when I get vaccinated? Then maybe we can also understand how we can resume normal life.
Thank you very much. So begin with when you're vaccinated, the process of vaccinating you is to make sure they introduce a part of the virus so that later on, when you actually get the disease, your body is able to remember that I've seen this, or I've dealt with this virus before, so that when you get the actual infection, you're actually protected. So what vaccination does is it protects you from getting the severe forms of the disease. It doesn't mean that you'll not get the disease.
Yes.
You'll get the disease, but you'll get a milder form. But of course, we've had patients who got the vaccination and then get some severe disease. But actually, research shows that actually, if you're vaccinated, the risk of getting severe disease is much, much reduced. And we're actually seeing it in our health facilities where some health workers were not vaccinated for some reason or another, and they come in and they are presenting and they have the disease. And then there are many myths about vaccination. It's a ploy, it's all what. We have a risk communication arm to try and venture with some of those myths and misconceptions. And some of them, social media, WhatsApp, there are many things that are sent on WhatsApp about blood clots and all those other aspects. And it was a challenge for the initial vaccination where I would vaccinate 5 people, 6, 7, not until when this second wave came and resurgence and people are rushing in to have the vaccination.
Maybe just to tell you, Walter, most of the people who came for vaccination at that very end,
yes,
during the resurgence, most of them actually had the disease. They would call you, you know, I think I have these symptoms, but I want my mom to be vaccinated because I was with her. So, and you try to tell them that probably your mom also has the virus, and they don't really get it. So those are people who got vaccinated, they already had the virus, and they're rushing to be vaccinated, actually even for the thinking it's medicine. Vaccination is not medicine. It's actually supposed to be there long before you get the disease. I have a testimony. My grandmom is 85. She got vaccinated when everyone else was saying, I will not get that. She got vaccinated, she got her second dose properly, then she got COVID about a week and a half ago. And she did so well. She has all these sicknesses, the blood pressure, all sorts of things. And me, I knew that would be a death sentence for her. But she did so well. She was like a teenager. She fought it like a teenager. She just came out so fine. So I believe most people think vaccination is some sort of medicine that we give. No, it's not. So please don't rush. When you have symptoms of COVID, go for testing. Don't rush to get what? Vaccinated. Yeah.
Okay, that's an important aspect. So if I find that I have COVID, at what point do I get vaccinated? Because these are now the questions you're going to be dealing with in the next few coming days.
So if you actually have COVID-19, you know COVID-19 is a new disease and we are learning. So recent guidelines by the World Health Organization say that if you have COVID-19 and you need to have vaccination, you'll wait a bit until after 6 months to 8 months. And then you can have maybe say a second jab, as opposed your first jab will be taken as the disease, as the COVID-19, so that you qualify for the second jab. So that is how it will be.
Okay.
Yeah.
And how do we revert into, public normalcy, normal life, like we are seeing in some other countries? Yes.
So I think how we move, those countries have massively vaccinated. Initially, the initial doses we got were from Indian High Commission, and later on you saw what was happening in India. So they withheld and said, no, we need the vaccines more than you do. So if we are to vaccinate, the target was we are 45 million Ugandans, but if we target about 22 or 23 million to receive the vaccination, you'll get what is called herd immunity, meaning that what happens to herd immunity? You have to vaccinate a number of people so that the few that are not vaccinated, maybe 5 or 10% are not vaccinated, they are actually protected. They are in the middle and they are surrounded by people who have immunity. So when the disease comes, it cannot reach them because everyone around them is immunized. So what we are seeing in the Euros, actually I follow the Euros very well. They do testing and testing. If you at any point you test positive, they isolate you for 2 weeks. And then later on they do a test and you come back. Okay? So for us to get there to normal, we need to embrace the vaccination, embrace the other SOPs, and then if you have symptoms and signs, go quickly to the hospital. So for now, let us encourage people to get the vaccination. Okay. And when they come, you realize we've received very few doses. Take this opportunity. I see people going to vote political leaders and they go as early as 4 a.m. So go for it. The areas have been publicized. They're on WhatsApp, the 8 areas per divisions. please go there early. Go there, it's your life. Go there at 5 a.m. or 6 a.m. or 7 a.m. Because curfew 7 a.m. and line up and wait to receive the vaccination if you qualify, especially the people going for second doses.
Okay. Yeah. Dr. Mariam, I'll take your parting shot. We have just about 5 minutes.
Thank you so much, Walter, for hosting us here and NTV. We really appreciate this when these messages go out to the communities that we serve. And right now, I just want to implore the communities, especially the health worker community, to please stay safe. We are not used to putting on masks and double masks the whole day, but please do it for you, for your country. We need you. We are few, and for your family, because when you die, probably your family will suffer the most. So let's stay vigilant. Let's test when we have symptoms. Let's not just test, but if you test positive, self-isolate. We've had people, before when we were doing very active surveillance, you would call somebody, where are you? You know, a patient that you're supposed to be following up at home who is in self-isolation. Down in Chikubo, telling you while watching Kwasaganya. But all that has to stop. We need to be very sensitive. If you test positive, sit at home, wait, and self-isolate so that you don't give the virus to the rest of your family. Okay.
For the sake of the viewers to actually, see who we're speaking to, I'll ask you to take off your mask and read to us the toll-free number so we can, have it in our houses and be able to use it. Then we move to Dr. Nyende for his wrap-up shot.
Thank you so much, Walter. Dr. Mulungi, Mariam Nantambi. Well, the toll-free line is 0800-990000. You can call on it every day, Monday to Sunday, 24 hours a day. Yeah. It's active, yes.
Okay. All right, Dr. Nyende, I'll ask you to do the same for people to see who we're speaking to.
Hey.
Yeah, and your parting shot.
Okay. Thank you very much. Today is a National Prayer Day, and our motto is for God and our country. So it's very good to go back to God when things are not as straight as they are. We've lost colleagues, we've lost workmates, we've lost classmates. So for those who have lost their dear ones, we grieve with you. And if you're still alive, we pray that you observe the SOPs. Go for the preventive mechanism. Access vaccination. I urge our colleagues. I know of doctor colleagues who have been fighting the vaccination and all that. And once doctors start saying don't go, then some of the communities will follow. I'll encourage. It's a new disease and many things are for learning. We don't have all the answers, but with time, if we stay united and we do what we ought to do, then for sure COVID-19 will be history.
Okay.
Thank you.
Thank you very much, my panelists today, Dr. Mariam Mulungi Nantambi from Luaga Division as the Supervisor Medical Services, and Dr. Louis Nyende. He is also the Supervisor Medical Services in Makinde Division. Now, vaccination is going to begin very soon. At least we know from the national medical stores that dispatches were made and delivered, quite a number of them. So once you check your information about the vaccination center and you have one that is close to you and you're in the category that is supposed to be vaccinated for now, which is the group that is waiting for their second jab,
and the health
please find a way to have this jab taken, because you need the double dose to boost your immunity against COVID-19. And vaccination doesn't kill. Actually, vaccination helps your body to be more resistant. And to those who have many questions about vaccination, you can call the KCCA number or ask any of your medical workers, get in touch with the Ministry of Health get to read from the several journals and scientists, you know, who write about these things. You could check with the World Health Organization to be sure of what you're taking or what you're not taking. All in all, we need to vaccinate to ensure that we can get back to our normal life, like you can see in the other countries. So don't be the one that will make 1, 2, or 3, 5 people refuse to take the vaccine. The vaccine is optional. If you really, really don't want to take it, please don't take it, but don't be the reason your neighbor will not take the vaccine. When COVID visits you, then the discussion will be between you and God. My name is Walter Mwesije. Let's keep vigilant, respect the standard operating procedures, easy things, washing hands, wearing your mask right. Don't put it on the chin, don't put it below the nose. Let it cover the nose and the mouth. Don't touch your eyes when you touch surfaces. And if you can get access to a sanitizer, sanitize your hands. Doesn't kill anybody. And let's ensure that we stay alive so that we can see this COVID-19 beaten. It can be done by you and me. My name is Walter Mwesije. We will have another discussion later on with other experts. But for now, I will let the normal programming take over. Thank you for being a great audience. Stay tuned.